that Jamaica confirmed 6 new cases of the COVID-19 coronavirus on the island, which brings to 8 the number of confirmed cases, including 2 males aged 63 and 67 who came into the island on March 7th from Trinidad and Tobago, having traveled from Malaysia by way of Dubai and London. They presented at hospital on March 11th. One male aged 36 who traveled from Manchester, England. He was taken to hospital from his hotel via ambulance on March 11th. And one male aged 31, a Jamaican overseas ship worker who came in from the Canary Islands via Portugal and Miami. He arrived on the island on February 25th and presented to hospital with symptoms on March 10th. And one male aged 58 who is the father of the first patient who was confirmed with the COVID-19 virus on the island. He was discovered ill at home on March 11th, and one female aged 34 who is a close contact as well, also of the first patient confirmed with COVID-19 on the island. The Minister of Health and Wellness, the Honorable Christopher Tufton, will meet with the media this afternoon, Friday, and provide further details, which I imagine will resonate across the Caribbean in terms of giving information. However, we do have on the line journalists with RJR Communications, Earl Moxham, in Jamaica via phone. Good morning, Earl.
Good morning.
Right, so you would have heard me read out the press release that we received from the Ministry of Health and Wellness just a few minutes ago from Jamaica. Can you tell us what's happening as you are on the ground now, particularly with this new information, bringing the total to 8 persons in Jamaica with the COVID-19 virus?
Well, you are basically up to date because that is, a release that came pretty late. And therefore, in terms of how the government and the public will react further to that, I think that's left to be seen today. But obviously, the matter of heightening the response, being more vigilant, is going to be unfolding today. The Ministry of Health has been clearing wards at about 19 hospitals to facilitate those persons who will need to be hospitalized and isolated as a result of this continuation of the confirmation of cases. It's important to note that of the 8 persons who have now been confirmed, 6 have traveled directly to the island with the virus, while 2 are local transmissions related to the very first person who was confirmed, that person having arrived from the UK. Mm-hmm. So what is happening now is that the authorities are tracing all the local contacts arising from being in close proximity to those who have brought the virus into Jamaica from their overseas travels.
I'd imagine that they're doing that in an effort to minimize the community spread of the virus on the island.
Absolutely, and that is a very intricate process, I suppose, because the contacts can multiply so quickly. So you have to really be on top of it. You have to heighten that public awareness. You have to make sure that, as best as you can, to make sure that those persons who have been in contact, that they realize that they themselves are exposed and that they should limit their exposure and that they should report honestly to the authorities.
What is the mood on the ground in Jamaica up until, well, I guess people will be waking up to the news that the numbers have increased, but up until yesterday, what was the mood? We saw some panic buying yesterday here in Trinidad and Tobago. Do you have similar occurrences in Jamaica?
We have had that kind of occurrence specifically in respect of hand sanitizers, anything that, masks that people think might help them. People have been panic buying more to get items that deemed to be protective items rather than just panic. And then there are some who are stocking up on food items and non-perishable items to make sure that they don't have to expose themselves too often in the supermarkets, for example. So that's the kind of response. But I would say that it has they have sort of toned down the sort of overreaction, because I think when the reality sets in, people realize, well, it's here now. The best thing we can do is to act prudently. I'm not saying that you will not continue to see some amount of over-enthusiastic shopping, to put it mildly, but I don't think that it is going to get so badly out of control.
Yeah.
Mr. Moxham, good morning. I know that Jamaica Carnival is actually coming up soon. Well, it's supposed to be coming up soon. What is the private sector response so far to the COVID-19 in relation to the events that lead up to the Jamaican Carnival?
There is every indication that all large public events are scheduled to come up over the next few weeks are likely to be put off. Now, I'm not pronouncing on what will happen to Carnival, but the reality is that everybody is arriving at the conclusion that these things are not likely to go ahead. The Kingston and St. Andrews Municipal Corporation has stopped giving licenses for public events, and in fact, they have rescinded more than 50 of those that had previously been given, and they have contacted the organizers of these events and told them that you cannot go ahead. We have rescinded the permit. So I think the organizers of carnival events will be taking their cues from that. And the private sector representatives have generally been very cooperative. The economy is going to take a major hit as far as events such as those are concerned. We are hearing from the Ministry of Tourism that the arrivals are down, that the figures are going to be particularly dismal over the next few weeks in respect of tourism.
Okay, well, we will have to leave it there. Earl Moxham, journalist with RJR Communications in Jamaica. We want to thank you for coming on this morning to give us an update with regard to what's happening in Jamaica. As reported, there are 6 new cases reported, bringing the total to 8. We'll probably check in with Earl Moxham again next week for further update with regard to what's happening in Jamaica, guys. So we see it there, and he spoke clearly about the panic buying. I'm happy to hear that it has calmed down, and we expect that that would be the same thing here in Trinidad and Tobago. Right now, though, we are going to go across to our brother station, our Big Bad Brother station.
Bad brother.
And you're part of that Big Bad Brother station.
Sometimes.
Next 99.1 FM. Good morning. Good morning, guys. All right, I think we might have lost them there a little bit, but that's okay, because we do have to take in a few messages. Remember, it's Glaucoma Week here in Trinidad and Tobago. While we have been emphasizing coping with COVID-19, we do have other things happening, and we want to have some level of normalcy in the country.
As much as possible.
You are smiling, right?
Because it's very difficult to try and maintain any kind of level of normalcy.
I refuse to panic.
Yeah, but I mean, people will get concerned.
Yes.
And we should take precautions to make sure that you and your family are safe, sanitized, and all that stuff, without panicking and causing a rush, but still being aware that,
And I think very important is your sight, your eyesight, and we've been talking about that all week.
Yes, we have.
It's Glaucoma Week this week, and I don't know if you know Rokas, well, Carrie would know because he's been here all week, but if you don't test your eyes regularly, and you have potentially you have glaucoma, right? But you don't know because you're not testing. Regularly. You can just wake up one morning and be blind.
Yep.
Right? And so I think it's just as important as we're telling people about COVID-19 that we tell people about, and we talk about the whole issue of glaucoma, which we've been doing this
all week. And we'll continue to do it today.
That's exactly what we're going to be doing after the break. Come back with us.